Okay, great. So hi, everyone. Thank you so much for joining us today and for attending our Child Safety Link webinar series. This is our next installment focusing on roadside observations from the Nova Scotia Child Restraint Use Study. My name is Samantha Noseworthy. I am a health promotion specialist with Child Safety Link, and I'm going to be moderating our webinar today. Next slide, please. We would like to begin by acknowledging that we are in Mi'kma'ki, the traditional and unceded territory of the Mi'kmaq people. We are all treaty people who benefit greatly from the shared resources of this land, covered by the treaties of peace and friendship. Next slide, please. So before we begin, just a few housekeeping items. So firstly, this presentation is being recorded and will be available to view after the session. It will be available on our website. We also ask that you mute your mics and keep your cameras turned off if you haven't done so already just during the presentation. And lastly, if you do have questions during the presentation, please pop them in the chat box. And there will also be time for questions at the end of the presentation if you prefer to unmute yourself and turn your video on and ask your question to Katherine in person. That's perfectly fine. We will have time at the end of the presentation for that. Okay, and for those of you who might not be familiar with Child Safety Link, I'm just going to provide a brief overview before I turn it over to Katherine. So Child Safety Link is an injury prevention program at IWK Health, and we are dedicated to reducing the incidence and severity of unintentional injury to children and youth in the Maritimes and also Atlantic where appropriate. Child Safety Link is committed to working with community organizations, government, and other partners to ensure children are as safe as necessary at home, on the road, at play, and at school. Our at-home portfolio includes poisoning and falls prevention. Our on-the-road work includes child passenger safety and pedestrian safety. Our at-play work includes helmet safety, concussion prevention, and ATV safety. And finally, at school is a new portfolio for us, and it is still evolving, but we will be addressing all of our topic areas within the school context. Next slide. So finally, I'd like to introduce our presenter for today, Katherine Hutka. She is a health promotion specialist here at Child Safety Link. Katherine is responsible for coordinating child passenger safety initiatives in the Atlantic region. She is a child passenger safety technician and instructor trainer, as well as being trained in safe travel for all children. Katherine is currently the president of the Child Passenger Safety Association of Canada. So thank you so much, Katherine, for agreeing to do this presentation and bring your expertise to the group here today. I'll turn it over to you.
Awesome. Thanks so much, Samantha. All right, so here's my little title slide, but I'm going to just dive right into it as I know a lot of people are still joining. So welcome if you've just joined. I know it's over the lunch hour, so I think some people are kind of like running to this presentation and trying to eat at their desk. So it's all great. Thanks so much for being here. All right, so we're going to talk about some of the observations that we've made from the Nova Scotia Child Restraint Use Study that we've kind of 4 months in now, or maybe 5 months in to the data collection. So we're going to talk about that. So before we get started, again, Child Safety Link, we have a mission to reduce the incidence and severity of unintentional injuries in children and youth in Atlantic Canada. And so, yeah, I just wanted to talk about that and why we're here and what we're talking about. It's also Child Passenger Safety Week, which is also a very cool initiative in across Canada, but also in Atlantic Canada. All right, so the main thing I want to talk about is why is this important? Why are we talking about how kids are buckled in cars at all? Right? Like, why are we focusing on this? Why is that one of the, the main, pillars of our portfolio here? And it's because we know that motor vehicle crashes are a leading cause of death for children in Canada, and we know that they contribute to those serious life-altering injuries as well. So we do have here the overall cost of injuries to children in motor vehicle collisions in Canada in 2018. The data that I had here was $83 million. And again, we're talking about, all of those different costs associated when a child is injured. We also know that for every child killed, an estimated 6 times as many children incur serious injuries. And, between 2011 and 2022, an average of 65 children between the age of 0 and 14 were killed each year in Canada due to a motor vehicle crash. So that's why we're here. That's what we're talking about. Because injuries to children in motor vehicles are largely preventable. So we know that when the right car seat or booster seat is used in the right way, the risk that a child will be killed in a crash is reduced by between 57 to 71%. We know that correctly used, appropriately sized car seats, booster seats, and seatbelts save lives. And so that's why we're here. That's why we're talking about. This is why we're trying to make sure that families, caregivers, drivers have that correct information. And we want to find out, how are they using that information? What do they know now? And so we know that the misuse of car seats, booster seats, and seat belts increases the risk of serious injuries to a child's head, neck, and spine, also to their abdomen and internal organs. So we know that when we see misuse, there's generally a common injury that's associated with that. So when we see children moving from a rear facing seat to a forward facing seat too soon, they're going to increase these injuries. When we see a loose harness or an incorrectly buckled harness or a low chest clip or the strap heights at the incorrect level, then we see an increased risk of injuries to the head, neck, and spine. When we see a loose or misrouted installation with the seatbelt or UAS, when we see maybe a lack of using the tether on a forward-facing seat, also increases the risk of those injuries, and incorrect recline on a rear-facing or forward-facing seat for that matter. And so some common booster seat or seatbelt misuses that we see are moving out of a car seat and into a booster seat too soon. Similarly, moving out of that booster seat too early and into an adult seatbelt too soon. We also see misrouting of the lap and shoulder belt over the armrests or out of the belt guides, or just generally in a place that's going to cause more injuries for children. We also see that misplaced lap belt that's too high on their abdomen or floating away from their body, or a misplaced shoulder belt that might be unsafely tucked under their arm, behind their back, or off their shoulder. All of these, again, increasing a risk of injury in a motor vehicle crash. Which asks the question, how are kids buckled in Canada? So there was a roadside study that Child Safety Link participated in 2011. This is the most current and most up-to-date information that we have at this point in Canada. And during that time, we found that about 99% of kids were buckled in some way in their cars, but we found that 73% of rear and forward-facing car seats were used or installed incorrectly in a key way, again, that could contribute to those injuries. We found that 30% of the kids who were using a booster seat did not yet meet the 40-pound weight minimum legally required for all booster seats in Canada. So 30% of those kids who were using a booster seat did not yet meet that weight minimum. We found that 52% of kids who were using a seatbelt did not yet safely fit the adult seatbelt without a booster seat. And of those, about half weren't yet legal to use a booster seat at that time either. So we know that families and need support to help to use their car seats and booster seats and seatbelts correctly. So how do we get that information? So in 2011, researchers and volunteer child passenger safety technicians, along with police partners, stopped passenger vehicles carrying children aged 0 to 14 and observed how they were being transported. We also know that in some cases they were just looking at car seats as well to see how they were installed as well. So we know that 1,323 children or restraint systems were observed. And this study was the most current information that we currently have about how children are transported in Canada. The study was only observed children in Nova Scotia, and this study is quoted and referenced in numerous places. I myself presented alongside Transport Canada last year in Toronto, and both of the people from Transport Canada did quote this study when they were talking about how children are buckled in Canada. So we know that this information, from our tiny province, is making a big impact as well across the country. What we don't know is what might have changed in the last 13 years. So 13 years is a really long time ago. How are children being transported now? How and where are caregivers getting that information and support? The world's a lot different now, 13 years later, for where parents and caregivers might be getting that information. How has 13 years of advocacy, training, and support influenced car seat and booster seat use, right? What's our impact? Let's find out. And of course, safety recommendations and car seat technology has changed since 2011. In some kind of really significant ways. How have these changes affected use? This is a question that we were really curious about. How are the kids now? What's happening now? Also, in the last 10 or 12 years, since the data for this study was collected in 2011, we know that over 3 million people have immigrated to Canada. We know that between 2015 and 2020, Canada welcomed 44,000 plus people from Syria. We also know that since 2022, Canada has welcomed an additional uh, what am I at? Sorry, here, 166,000 people from Ukraine. We also have this stat that 20% of newcomers in Canada at this time are children aged 0 to 15. So we also have a lot of people who are new to Canada in the last 10 or 12 years. So why are we asking this question? Why are we talking about that? Why would we expect that newcomers would be at a greater risk for misusing car seats and having children who are at greater risk for injury in a crash? So we know that there are lots of different factors, including language barriers, cultural differences, and a key difference here is the difference in the laws of their country of origin. So there was an unpublished study that was done out of Safe Kids in Toronto. It was halted due to 2020, due to the COVID pandemic. But what they were finding was that there was a much greater risk for newcomers for non-use of car seats, or what they were calling gross misuse, meaning car seats not being attached at all, the child not being buckled at all. And they did suspect, and they did draw a correlation between the laws, not having seatbelt or child restraint laws in the family's country of origin. And so that was something that we were curious about. How are the newcomers transporting their kiddos, and where are they getting that information, and how can we make sure that they get that we know that data, that we have that information, and we can better support families in our community. So we also know that the differences in the perception of safety and hazard for families who might be coming from conflict zones also means that it feels really safe to put your child in a car in Canada if you are coming from a conflict zone. It's sometimes really surprising. I used to give regular presentations at ISANS to newcomer families, and when I would tell them these stats, when I would tell them that the number one reason that children are injured or killed in Canada is in car crashes, they don't believe me. Right? That seems really strange. Really, this is the way. This is why does Canada care so much? This is it. And so that can be really surprising to families who've had that kind of a different perception of safety and hazard and risk. But we're in luck, because updated information is coming. So Child Safety Link at IWK has been working with Dalhousie University research team to update this research and to add to it with the support from our partners, including CIBEX and also the Child Passenger Safety Association of Canada. All right, so where are we at this moment? I have given this presentation before. Maybe some of you have sat through those preliminary slides, but I want to tell you where are we at this moment. So I am pleased to announce that we are currently at the halfway point for the largest roadside study of how kids are buckled in Canada right here in Nova Scotia. So we are at the halfway point, and we're going to tell you a little bit about how we got there and what we found so far and where we're going. All right, so here's our study. So here we have a timeline of the study. So, I mean, we've been working on this for 2.5 years, I think, is when we first started having like preliminary conversations. And so first we had sourcing some funding. So this project's been funded with the support of our partners in part. We needed to develop the survey and observational tool questions as well. Then we needed, the big thing was ethics approval. So the application was submitted in March and approved in April. So that was a big hurdle. Then we needed also to plan some training for our staff at Child Safety Link and our researchers at Dalhousie, and also some volunteers and some other agencies as well. So we did a lot of training in March and April, and even in June and August as well. And we are here. So collection. So the data will be collected May through November 2024. And we are at that halfway mark. So that is where we're at now. And then our final stage, of course, is going to be analysis. So Dal is going to review the data and compile the findings so that we can all share them and we can find out what the results are and what sort of conclusions that we can draw from what we found. So here's our plan. I'm not going to go through all of it, but generally the plan is for 35 plus 2-hour-long checkpoints throughout Nova Scotia to observe how children and youth under the age of 14 are buckled. And we provide education on the correct car seat, booster seat, and seatbelt use. We help that family to make or driver to make any corrections to use and installation. And we want to ensure that all children observed meet the legal minimums on departure whenever possible. We have been fortunate to have replacement car seats and booster seats. They've been largely available when needed, and they have been needed. And as well, each driver who agrees to participate in the study and answer the survey questions also receives a $10 gas card for their time for participating in the study as well. We've been really lucky to have the support from fire departments and several family resource centers, as well as community volunteers, and of course our RCMP and city police partners as well. So what information are we collecting? So our observations will include what type of restraint. Is this a rear or forward-facing car seat? Is it a booster seat? Is it a seatbelt? Are they unrestrained? Were there any seat issues? Was this the right seat for this child? Did they meet the weight and height minimums for using the seat, or have they exceeded them? Does the child fit the seat? Is it expired? Is it broken? We're also observing installation issues. So was it tightly attached to the car? Was the tether used? Was it tight? Was it attached to the correct anchor? Were other features that were either optional or mandatory on this seat used correctly? We're also looking at how the child is harnessed or buckled. So were the straps tight? Where was the chest clip placed? Is the seatbelt in the correct place on the child's body? And of course, we are also noting seatbelt use in the driver as well. Although that's a challenging one to document, because for the most part, when people see police in the distance, they buckle up even before they get there. So we also do have some questions for a questionnaire as well. So we're going to ask them the child stats, including age. Gender's on there. We do not ask that. But age, weight, and height we're largely measuring, but we're also asking for kids who are too little to go on our scale, or where they don't choose to be measured. We are asking questions of the driver. So what's the relationship to the child? We're asking, are these your kiddos? Do you have other kids at home? We are collecting some kind of high level socioeconomic data, just being we are asking highest level of education completed. We're asking postal code and also homeowner status. And that's a way for us to kind of figure out if there are, extrapolate socioeconomic information. We are asking them if they've had any prior car seat support. So who has talked to you about car seats? Where have you gotten that information? What information did you get? And when was that, right? We are also, of course, collecting that information about whether or not that this family is a newcomer driver. So we are asking the country of birth, or where, country of origin. We're asking how long they've been in Canada and the primary language spoken at home. I will say when we ask these questions, we're telling them why we're asking these questions, because they want to know. And we say, we're trying to figure out who needs car seat help, where they are, what languages they speak, and how we can best support them and find them and help them, before we stop them at a roadside check. So we want to make sure that that information is as available as we can. And we do talk to all of the families about the fact that this is an informational, educational car seat check. No one is getting a ticket at these events, I should say as well, about the way that they're transporting a child. So they're very supportive, very educational. And they're a little bit away from the roadside too. They're not directly at the roadside. And I think people do feel that there is, okay, we've been stopped by the police, but now we've been brought over to the helpers, right? We tell them we work at Dalhousie, we work at IDVK. This is our job. We're just trying to make sure that all of the kiddos are safely using their car seats to make sure that if there is a crash, that that your child isn't going to be it'd be less likely to be hurt. So here's our roadside data collection process slide. So here we have first our roadside checkpoint. The police direct their cars with children who are aged less than 14 to our study team. There is a consent process, so the research assistant obtains informed consent. We let them know what the risks are to our study, why we're collecting this information, and then we ask them for their consent to answer our questions. We have our short survey of 10 questions, and the research assistant conducts the survey, and then they pass them over. Oh, sorry, I see now that Mark's name is on this slide. And then they pass them over to our CPST, who does the child restraint inspection. And so they use a form that's very similar to the regular check form, but it's an observational tool, and they're going to perform that seat inspection. And then we're going to provide corrections where needed. We're going to help them figure out the things they couldn't figure out before. We're going to educate them about the things that they might need to change to make sure that that seat is installed safely or used safely going forward. And in some cases, we do provide a replacement seat where needed. So at the end of participation, we thank them. We provide them with a little package of educational materials about the kiddos that are actually in their vehicle or the questions that they had. We tell them that we have a 1-800 number where they can call and follow up and ask more questions. And they also get a one-page with all of the information about the study, but why we're collecting this data and who is collecting this data as well. And finally, of course, they do get that $10 gift card as well, usually for gas, but sometimes it's a grocery card depending on where we could acquire a gift card that day. So what have we done so far? So to date, we have completed 18 separate check events in 5 different counties in Nova Scotia, in Colchester, Cumberland, Pictou County, Hants County, and Halifax County. Events are on average about 2 hours in either the morning or the afternoon. Some of those dates we had more than one check in the same day. If we've already driven to Pictou, we might as well do one in the morning and one in the afternoon. We try to make them no more than 2 hours, no greater than 2 hours. We find at about the 2 hour mark, we're finding people who are coming specifically to get their car seats checked. And so we don't want to skew the data in that way. And it means that the community has figured it out, which they usually find out pretty fast where we are. Everybody's very connected. But once people start driving there intentionally to get their car seats checked, we don't want to include those very willing and participants in the study. We want to see people kind of in their natural element, right? Without coming to say like, I'm hungry, I'm searching for this information. Can you please help me with my car seat check? Of course, we help them, absolutely. But we did find that so usually around the 2 hour mark, the tone changes and people are coming for different reasons. On average, each event has had approximately 5 child passenger safety technicians and 1 support person. That's our research assistant who asks those survey questions, or in some cases, plus our police and fire partners as well. Some events have had fewer CPSTs and some have had more than that as well, but this is our average. And on average, we've given 40 seats total have been provided so far. And that's an average of 2 seats per event. And I put a little asterisk there because I did want to say that in some cases we're really limited by how many seats that we have to give away, mostly because the seats that we have been donated are really large. And so when we go out, we can only take so many with us at each event. And there's always this balance of like, do I give them this seat when theirs has just expired versus who might be coming, in the next 20 minutes who doesn't have a seat at all. And so it's a bit of a balancing act to balance the resources that we have. And so we could have definitely given out more seats than we have. And that's just something that we've really had to balance over the last, it's been a learning for us over the last 18 events. So our totals and averages so far, here's some numbers. So the total vehicles that we've seen so far, we've had 332 vehicles who have agreed to participate in the study. We've had an additional 59 vehicles who have not agreed to participate in the study. And so we've observed and supported 391 cars total. And so that's an average of 19 to 22 vehicles per event. And for children aged 0 to 14, we now have documented 514 children aged 0 to 14 total in the study. There's an additional 77 children that we've helped in some way, but did not consent to participate in the study, so we can't, report on that data. And that's for a total of 591 children total have been observed and supported. And so that's an average of 29 to 33 children per event. that are seen. And some of those events were really small and in really rural areas, and others were pretty hoppin', pretty happening in areas where a lot of people were driving by in those moments too. And we did have an average of 1.55 children per vehicle on average. All right, so which brings us to the data that we've got entered in so far. So I'm going to turn this over to Tanner. If I haven't introduced you, Tanner, but I know he's here somewhere on this call.
Hi.
There you go. I can totally hear you. And you can feel free to turn on or there you go. There's your camera. And I'll keep sharing that slide. So if you wanted to talk about how you entered this data and built that tool or anything else you wanted to say, now's your time.
Perfect. Yeah, well, thank you, Katherine. This is wonderful so far. So yeah, I'm one of the researchers at Dalhousie University who I built the REDCap survey questionnaire that all this is going into and everything. And I've worked very closely with Katherine over the past several months to sort of like get all this going and keep it going. And we're having a lot of fun so far. And I'm very excited to like offer some preliminary data. Obviously, not all of it is yet put into the system. So the way it works is, yeah, we fill it out on paper. Katherine and I will sort of like double check everything. And then either myself or somebody else will sort of enter it into a database. And then from there, I can pull out the data and analyze it. So I haven't yet cleaned this data. It's not all in yet. So we're not going to bother with all of that. So I do first and foremost want to stress that these numbers are absolutely going to change. I just wanted to sort of give like a rough idea of where we were headed and give you folks who maybe are interested in the idea but not just need like a little bit more incentive to want to show up to one of these ones because they're kind of fun. They're pretty fun days. And so yeah, anyway, sorry.
We have a good time.
We have a good time. So far, yeah, as Katherine said, we have into the database, I have 381 child restraint forms and 254 driver questionnaires. So based on those data sets, yeah, we've got an average of about 1.53 children per car. Some basic information about the drivers, 77% of them identified as the parent and 15% identified as grandparent. The other 8% were sort of a mix of caregiver or sibling. But the vast majority definitely are parents and grandparents driving these kids around. 91% of these drivers were born in Canada, and 94% of them identified English as a primary language spoken at home. When asked, 59% of them said that they received information on how to transport their child safely. Mostly this information was from the hospital, Maggie's Place up in Truro, if anybody's familiar with there. The IWK, obviously, in the child safety link. But yeah, it still shows that 40% roughly of these people didn't necessarily have an answer for did they receive information? They're like, nah, I didn't really. Nobody's really told me anything. For the child restraint, we've got about 93.4% of children met the age, height, and weight requirements for the restraint that they were using, which is pretty good. There's the frequencies over on the left-hand side. So 34% of the kids we've seen showed up in booster seats, 24% in seat belts, 28% in forward-facing, and 13% in rear-facing. Sorry, I'm not used to the pop-ups. That's so exciting, Sarah. Please send an email to Katherine. Absolutely, anytime. Next slide, if that's okay, Katherine.
Absolutely.
Thank you. So then this is like the big fancy number that everybody's excited to see all the time. So up in the top is the number of, or is the child restraint type. So if they show up in a rear-facing, forward-facing booster or seatbelt, regardless of if that's the right type of seat, we document sort of how they show up on arrival. So of the 357 now documented kids that showed up, 106 of them, so 29.7%, had no errors or misuse whatsoever to report, whereas about 70% of all the kids who showed up had some form of error. Could be small issues that just could be fixed on site, could be like a twisted tether or twisted straps, improper tether. It could be like vehicle issue, those are pretty rare. But any sort of issue that would prevent the kid from being able to like safely ride in that child restraint would go there in that like 70%. And then we've got a breakdown of it by restraint type. So yeah, we can still see that forward facing is quite is still pretty difficult. I believe the literature shows that that was always something that forward facing seems to be pretty hard for parents to figure out because everybody gets a lot of information on rear facing. So this sort of reinforces that the work that we're doing for forward facing is good. We got to keep going.
And I think the other reason that that we identified that more people had an error with forward-facing is that extra step, that tether, legally required in Canada for all forward-facing seats. And so that was something that people had a real challenge with. And I do believe that's the big jump from rear-facing to forward-facing, along with, like you said, people had more support, had more information about rear-facing as a stage. Yeah.
Perfect. Next slide. I
I think it's
believe
back
this
to
is
me and kind of
me.
stories from the
Yeah.
roadside, but you can still feel free to kind of to share along or to participate if you want, Tanner. Totally up
Yeah,
to you.
I'm gonna
Yeah.
jump into the chat there because I see people have stuff and I'm gonna try and answer what I can.
Oh, you know what? And
Um,
we can ask some of those out loud too, just to kind of like include them in other ways. You know what? Why don't we? Do you want to save the questions for the end, and I'll just keep going for a little bit? What do you think?
yeah, yeah.
Does that make sense? Okay. All right,
Please,
awesome. So this is our
please.
kind of like, yeah, and thanks Tanner for presenting those numbers for us. I know people probably have questions, but let's just hold off to the end. I do want to share a few of our stories and observations, and I'm really aware of how much we've already talked and how little time there is. So I just want to kind of get into this. So I just wanted to share a few stories from the roadside. These are just some photos that we have. Unfortunately, we don't have any photos of the stories from the roadside because we weren't going to take photos of people who were pulled over. So we don't have a lot of photos of kids, of families, of car seats. We have lots of photos that we have taken previously, but for the most part, our photos are us holding a car seat, sitting in front of a fire truck, that sort of thing. So I'm going to tell you a couple of stories, just of observations that we've made. And so the first story that I want to tell you, it was very, very early on. Oh my goodness, you know what, Tanner? I think it was the very first day. It was in Springfield. And we had met this family. It was the very first car seat that we gave away. And this family, what they had was they had a 2-year-old forward facing in an even flow car seat. They had a 10-year-old in the middle of the back seat in without a booster seat. So we had a 10-year-old in the middle, and then we had a tiny, tiny 3-year-old in a backless booster on the other side. The vehicle was really small. It was a Ford Fiesta. It's a very, very tiny vehicle. And the family was really, really interested and engaged in child passenger safety information. So they had an idea that the 3-year-old was not in the best seat. Okay, so the issue here, of course, was our 3-year-old, our 35-pound kiddo who was in a backless booster, and legally and in all other ways, they still did need to be in a forward facing harness seat. And when we saw this kiddo, she was kind of all over the place. Like she was getting up on her knees and squishing her, like she definitely was not ready to sit on a booster seat with a seatbelt alone. Whereas, you know, her brother was in a forward facing seat, he was all buckled, and the older sibling there was mostly her job to make sure that this kiddo mostly stayed seated. The family was really grateful for the information. They kind of knew the kiddo needed to be in a forward-facing car seat, but what had happened was the younger sibling needed the seat, and they didn't have another one, and so they were using the backless booster. They took the backless booster from under the 10-year-old and kind of did the car seat shuffle. And the family was really, really grateful for the car seat that we were able to donate to them. And they had lots of questions. They really wanted to make sure that their 10-year-old was safely seated. They had some concerns. They didn't want her to be out of the booster seat yet. And we were able to, you know, to reassure them that she met the height and weight, that how the seatbelt should fit her correctly, and what they were looking for. And they were so much happier when we helped them install the forward-facing seat for the 3-year-old, because then the 10-year-old could relax. She wasn't all over the car. She wasn't developmentally ready to move to that booster seat yet, and they knew it. And so they were really, really happy and really grateful. So that's the first story that I wanted to tell as our story from the roadside. All right, so here's some more pictures. I wanted to include this. This is our setup where we have like a car seat on the table, a booster seat. When we're lucky, we have a backless booster seat. So here we have all of our resources ready to go, and Drew smiling behind the table as usual. I also wanted to include this, which is how hot and sweaty and frazzled you kind of are at the end of these kind of happening and hopping roadside events. Yeah, so I put a not so TV perfect photo of myself in there. And then I included these seats, which they're kind of some interesting photos of these two particular seats. So I did say I wasn't able to share a lot of photos, but these are some seats that we did replace at Roadside. And so here's another story from a family. We did have a family who was pulled over on the side of the road. And that family, they were newcomers to Canada. And as they were pulled in, the police did note that the mom had the baby out of the car seat and was nursing her in the back seat, or nursing him, can't remember, for that particular baby, and that they had another kiddo who was probably 2 years old sitting on top of this seat. And so when we pulled them in, we let them know, we're going to make sure that these kiddos are safe and are using legal Canadian seats. So these seats, they're not Canadian, they're not American. They may meet the standards of another country. They said that they bought them in Italy, but I didn't see an Italian or European kind of standard label on them. Yeah, and so this particular seat, it was in the vehicle, but it wasn't attached in any way, and it was just found sideways in the middle of the back seat of the vehicle seat. So this family was aware that they needed car seats, but they weren't really sure entirely what they were for, or why they needed to use them. And so at first they had told us that their kiddo was absolutely buckled in this seat in some way, but we didn't find any evidence of that. And later they did tell Drew, he was getting fussy, and so we took him out. Like he wasn't feeling very good that day, so we took him out of the seat. And so both kiddos were unrestrained in the back seat of this vehicle. And this was also a really rural community in Nova Scotia. Like as you saw with the stats, we didn't see a lot of newcomers yet because we haven't gone downtown. We haven't done Halifax and Dartmouth yet. But yeah, so this family was, they really weren't aware of what they needed to know to keep their kids safe or what car seats were really for. And so this car seat was not attached to the vehicle in any way, nor was the kiddo buckled into it. He was just sitting on it like a chair. And this seat, again, the baby was not in it. So we were able to replace those with safe Canadian car seats, educate the family about why car seats were needed. And they were very pleased to have those car seats. And I think they were pretty relieved too to have this kiddo securely buckled in a way that he wasn't going anywhere. But it was definitely a surprise for him. It was definitely new to being all the way buckled, and I think he kept saying stuck at the end. He was like he was surprised to be buckled in. But the family was really receptive, and we had a great group of volunteers and support that day to help us with that, because it was a really involved, we needed to get access to the tether of their vehicle. We needed to kind of like unpack their groceries from the trunk to access that tether. So it was a lot of work. It was hot. I think it was the very last check of that day on I think it was the hottest day of the entire summer that particular day. So yeah, so that family is riding safer. We know that they were at great risk for injury in a crash. Even a small fender bender or a sudden stop could have injured those unrestrained children. And we were able to provide that education and support. And I think they felt really supported by us too. And, we did our best to tell them what they needed for safety. So I wanted to share that story. Okay, here's some other photos of other days that were maybe wetter. I don't know, the stuff on plastic here. We did have a couple of rainy days. Our team decided that we all prefer rain to extreme heat because the extreme heat was just worse as we did this. This was such a lovely photo of this volunteer that we had. And so I thought I would include it, and where we don't have any identifying information on the kiddo. So another story that I wanted to tell was, again, early on in a fairly rural community, we had a family who refused. So they did not want to have their car seats checked. They refused to participate in the study. And I said, absolutely, that is totally your right. Can I ask why? Right? Like as we were talking throughout, I asked why they refused. And one of the things they said was, I know car seat information, they said, and I have no evidence that anyone at a hospital, that IWK knows anything about car seats, or that Dalhousie knows anything about car seats. And so why would I let you guys check my car seats? Like, you don't have any more information than I do, and I've done a good job. And I was like, okay, yeah, fair enough. So that was really interesting to hear. I did say, like, before you leave, I have to make sure that your child is buckled in legally and safely. And I found no errors. There was nothing that I could really talk about. The kiddo was buckled in perfectly in the right stage of seat. And so they were on their way. But it was one of those things where until you hear it, you're just really not sure. And so, hearing that they have this mistrust in a hospital system, I don't know where that mistrust came from. Like, did they get misinformation at birth, where we know that most of the families got, reported that they got car seat information at the first discharge of their child from like a hospital in Nova Scotia? Like, where does this mistrust come from? Why do they think that no one at Dalhousie knows how to use car seats and that no one in a health center would know how to use car seats? And so that was just something that kind of made us think. And they were a young couple too. They were not very old. I think they were likely, less than 30. Yeah, so that was another story that I wanted to share. Here's another image here, a hot day. We were really lucky whenever we had an awning or a shade. Sometimes I brought the awning or a shade, and sometimes they were graciously provided by a fire station partner, which has been really great. This one we're kind of hiding in the shade of this building here. And here, I've got one other story that I wanted to tell, where a lot of these checks were done over the summer, where we had a lot of grandparents and parents who were not used to transporting particular kiddos. And so we had a situation where a grandmother, she knew exactly what she was not doing. And so she had twin girls who were not yet 9 years old, so not yet legal to be in the seatbelt alone without a booster seat. And they had a teeny tiny boy in the middle in a backless booster seat. And as I started talking to the kiddos and the family, the kids knew exactly what they needed to be doing, because at home, both girls used booster seats, and the littlest brother used a forward-facing harness seat. But the grandmother wasn't too aware of it and wanted things to be easy, and they felt like they were in summer mode. And so they grabbed just a backless booster for the little guy, and they did not have, and they chose not to have boosters for the older two girls. So the girls knew exactly what they needed, and they were totally embarrassed by it. And I said, you know what? It happens. I'm just so glad that we found you here today. We were able to provide, a safer seat for the kiddo and booster seats for those girls to get home safely, because they were really short. They did not meet the height minimums, nor the age minimums to use a seatbelt without a booster seat. They were at risk of abdominal injuries and head injuries and other things. And they were actually pretty stressed about their younger sibling being, unrestrained in the car in this way. And yeah, the grandmother was really embarrassed. She definitely knew. And so we, from that, we're trying to think about the question of, like, are people, sometimes choose to, did safety take a vacation for this family, right? Because they're very used to using the right car seats and booster seats at home. And it was just like this trip to the country with grandma where they didn't choose to bring those seats. So it's just another kind of situation where we help them to be safe, and we're able to provide them with a safe seat to continue on their way. Here's an image from us on Tuesday in Lower Sackville. And so here I just wanted to kind of tell a few other stories, just kind of some general things that we found. Overall, we did find some differences between one community or another that, might come out in the data, or they might just come out in our anecdotes. But we were in some communities, we did ask that question of, like, is what we're doing, does it matter, right? Like training CPSTs, having support people at family resource centers who know this information, training first responders in this information. Does it help? Does it matter? And we heard from the people that we stopped, that we pulled over, that we checked their seats, that it does matter. So we did have some families, and I said, wow, you've done a really good job there. And she's like, I had it checked by my sister-in-law, my friend, my cousin, my, the person at the family resource center. And often we knew them. So it turns out Scotia was a really small, it's one big small town in some ways. So I was able to say, like, oh yeah, who's your sister-in-law? Okay, oh yeah, who did check your seat? Oh yeah, I know them. And so we did find a lot of people who said, I was taught how to do this by a CPST. My seat was checked by, people who are knowledgeable in my community. There was another community that nobody really name dropped in that way, But the firefighters came out and they said, 10 years ago, geez, we did a lot of this information. We were all trained. We haven't done anything since COVID, like the last 5 years, but for 15 years, 10 years, we did car seat education in this community. And, I found that the proof was in the pudding, and I did find a lot of families who in that community, I was just like, wow, this is a really small community in Nova Scotia, very specific. Why, what's the difference here? Why are people doing a good job? Right? Like, how come there's less misuse in this community? And then I heard that from the folks at the fire station. And so, yeah, so the things that we do matters. This information is shared and spread between parents and caregivers and family resource centers and health centers and first responders. So I wanted to share that. And yeah, I think that might just be all of my little stories from the roadside. Was there anything you wanted to add, Tanner? Not to put you on the spot. Or maybe we'll just respond to questions at the end. I'll just keep going for now. But those are some of the stories that I wanted to share just to kind of give you an idea of the kinds of situations that we found. Okay. So here's our little, this is my thank you, really. Teamwork makes the dream work. So I didn't put together all of the names of all of the people who have helped us along the way, but I do have them. And we're just so very grateful to all of the fire stations and the volunteers and the police officers and the RCMP and the family resource centers and all of the individuals and volunteers who have come out to make this plan, this dream a reality. So we've had our police partners, our child passenger safety technicians, our volunteers, and our community support partners who help make families feel safe. When stopped by police, which is a really stressful situation in some cases. And so we've really been so very grateful to all of our partners and our supporters and our volunteers and our help. So teamwork makes the dream work. It certainly has in this case. There is training available to become a child passenger safety technician. I will be in Newfoundland next week training people in that way. I'm very excited about that course, but we don't have any left kind of coming up in 2024 that I'm aware of. I think there might be yeah, so that's something that we've done a lot of training, but we don't have any in the current books, but that's not to say that we won't do it again. Of course we will in 2025. And in the meantime, if anyone does want like a 2.5 hour online child passenger safety basics workshop designed for folks who transport children as a part of their work, please send me an email and I will send you a code for that or the way to apply for that code because that is a free online training that is offered as well. So here's my little plug about future event planning. This was a colder climate clinic, which again, they might be coming up in late October and November. So we've identified local partners and supports, and we're working together to choose dates and times, including our police partners. We've completed, again, 50% of the expected target goal of this project to date, and our plans for the fall include locations in Halifax, Dartmouth, Bedford, Halifax County, which goes from Mount Uniacke to Hubbard. So it's kind of broad, but we are looking at locations in all of those places. But we're also planning to travel to Cape Breton for a few days with our partners. We're planning to hit up Antigonish on the way. We're also planning events in Bridgewater and also Kentville, our two, like the Valley and the South Shore, are two places that we still need to make sure that we have some data collected from those areas as well. And we have some partners to work with. So if you're on this call, write me, follow up, and we'll figure out some dates that are going to work for everyone. Yeah, and so that's my kind of final slide with some of my contact info there. And if there's time for questions, Samantha, maybe we could open the floor up to questions.
Yep. We have a couple that came through in the chat as you were presenting, so I'll start with those. We have about 10
Okay,
minutes left.
awesome. I was hoping for that.
Okay, so we had a question from Jennifer. She asked, is there a sense that Nova Scotia may be different than other areas of Canada? For example, areas with higher proportions of new immigrants, and is this study being done elsewhere in Canada?
Right. So we do expect that it is different. And one of the ways that it's different is that Child Safety Link's been a program for over 20 years, specifically with this goal to address child passenger safety. And we've been doing a lot of great work. So we've heard from a lot of people who have heard of us, who have I got that postcard already when I had this baby. And, like we heard from a lot of people that the advocacy and the support that we've put out there has reached them. And so I do expect that that what we find in Nova Scotia may not be, completely comparable to the rest of the country. Of course, it wouldn't, right? That there would be definitely regional differences, but I do believe that one of the ways that it is different is we have a comprehensive, child passenger safety strategy for Nova Scotia that we've been implementing over the last, 22 years in some aspect or another. And so I do expect it would be different in other parts of the country. As for replicating it in other areas, there's a lot of pieces that goes into this. I'm not saying it's not doable. It absolutely is, but it's a lot. And so one of the deliverables that we're planning at the end of this study is a how we did this and how you can too. We would like people to replicate this. We want people to use the same survey, the same tools, something where if they did this survey, we could compare the data and we could find out what the differences are between one area to another. And again, right now we haven't gone downtown yet. We do now have police partners, and we're working throughout the month of October to do Halifax, Bedford, Dartmouth, and we are planning to go in areas with high concentration of newcomer families, so that we can have those numbers as well, and we can find exactly what you expect to find, right? Caregivers who need help and support and free car seats. So that's something that we're going to add to our study and make sure that we include that information, right? We haven't, going around rural Nova Scotia, we found the odd family or two, but we really want to go to those high concentration areas as well to make sure that we can accurately represent all of the families that are in and around Nova Scotia as well. So I do think it would be different in other areas, and I think it might be different from one community to the next. We found it to be different from one community to the next. 20 minutes up the road, why is it so very different, right? And so that's something that I'll leave to Tanner to figure out what we can glean from that. But we did find that this is a community where Maggie's place is right there, and everybody, we had one family that we stopped. They knew their car seat was expired. They knew it was unsafe. They had a 4-day-old newborn, and they were on their way to Maggie's place to get their car seat checked, and they were getting a new seat when they got there, right? So like people in Nova Scotia know where to find this help and support in a lot of communities. So yeah, it's kind of different.
Okay, and there was a question also reflecting on the high amount of misuse. Do you know of any developments that are being made to change the technology to make the seats less prone to misuse? What's the industry doing? Any comment on
So
that?
there's lots of different things that the industry has done to reduce misuse, but at the same time, there's lots of different new and interesting features that families are misusing as well. And so, like my overall impression of how that's going is yeah, there has been industry changes to try and make car seats easier to use. Car seat companies are putting QR codes on their seat that lead to video instructions. They are working on it. Nothing's mandated. It's just sort of like, it's coming out of their own, altruism and research and wanting to make sure that their car seats have good ease of use ratings in the US. But car seat companies, the tether in some cases, so like certain companies are coloring them yellow or coloring them red, or somehow highlighting them so that caregivers see the importance and also the difference between that strap and some of the other straps on the seat. But I couldn't really say that the changes in technology had increased or reduced misuse, I would say, versus the 2011 study.
Okay, great. Thank you. We probably have another 2 minutes. We have a couple of wrap-up slides that we need to get through. If there's any, okay, we have one other question in the chat. Do Nova Scotia families have financial support, or sorry, does Nova Scotia have financial support for families to get car seats?
We actually do, and better than any other province in Canada. So any family who is on provincial income assistance, it's a guaranteed amount, right? So like in New Brunswick, there's an amount like to set up if you're welcoming a new child into your family, but it's not separated out. So like they could buy a crib, or they could buy diapers, or they could buy other things. But in Nova Scotia, it's a specific amount that can only be used for a car seat. So on entering the income assistance program, they are entitled to funding for a seat for every child that they have under a certain age who still requires a seat in Nova Scotia, or on the birth of any new child. They're entitled again to an amount for a car seat for that child. So we actually have better supports than in other areas. And of course, would be, need to mention that also Child Safety Link has had car seat grants available in Nova Scotia and in some cases Atlantic Canada over the last 2 or 3 years, so that family resource centers had an amount that they could spend to provide car seats, safe car seats for families in need in their communities. So we do have better supports than a lot of other places in Canada, and we're really lucky to have that.
Great, thank you. If there's no other questions, maybe we'll just do wrap up. And Katherine, I'm sure, I don't know if you want to put your email specifically in the chat. If folks want to reach out to you, are you okay with that? Oh, it's right here on the slide.
It's on
You're
that
prepared.
slide, but we can type it out. Maybe Mallory or Drew can type it out for me. But yeah, so that's my email. You can definitely contact me. Anyone who wants to come out and have a good time with us at a roadside. Nobody asked the obvious question: was, are people cranky? That's the obvious question. Like, are people mad? Some people are, but some people are like, oh my goodness, I've been looking everywhere for this information. I could not find how to do this. Do you know? Do you know how to do this thing in my car? And we do, right? So we've been able to help people who are really looking for this information, and they have tried. They just haven't found any way to find the answers that they're looking for. But we do also have some people who are not overly thrilled to be there. But for the most part, no one's been really, we don't feel like anyone's been particularly mean. We've had the support of fire people and police partners and community partners. Everyone knows we're there to support and to help. But we have had a few. People have been really great about it. I have to say, people are in a rush. We're like, yes, absolutely. Do you have to wake up my kiddo? Let's see what we can do with this kiddo still asleep, right? So people have been really gracious and lovely. We've met a lot of lovely people throughout Nova Scotia. So yeah,
Great.
I'll give you your
Thanks.
wrap up slides there, Samantha.
Okay, and yeah, one other question came through, but Katherine, maybe you can follow up with that person via email. Okay, great. Yeah, so we're just running out of time here, everyone. Sorry about that, but I just want to say thank you so much for attending. This was really informative. Thank you, Katherine, so much for presenting on this preliminary information. It's really great that you guys have taken on this project. So a copy of the presentation plus the recording, if you want to reference it, will be available on our website. I also just want to take a moment to plug our community of practice. So you can join the link to connect with other injury prevention professionals. There's lots of great resources. You'll get updates on this study, for example, as progress is made and more information is available. And Mallory has popped the link to register in the chat if you are interested. And I think that's it. I think our next slide is just our contact information if you want to reach out and ask any more questions. And Katherine's email is in the chat if you want to reach out to her directly. But thank you so much, everybody. And that's it for today. Thanks, Katherine. And thanks, Tanner.
Yeah, thanks, Tanner. I know I put you on the spot to make those 2 slides, but yeah, thanks so much and thanks everyone for tolerating our kind of like messy, it's not quite finished midpoint of the study, but I appreciate it. Thanks.
Thanks, everybody.